Inherited cardiac conditions are diseases that are due to genetic abnormalities, and these genetic abnormalities can affect various aspects of the heart, including the heart muscle, and genetic diseases due to heart muscle diseases, due to heart muscle faults are called the cardiomyopathies, of which the most common is a condition called hypertrophic cardiomyopathy, which is present in between 1 in 200 to 1 in 500 individuals in the population. There are other conditions that may affect the left and the right ventricle, such as the arrhythmogenic ventricular cardiomyopathies as well. Then there are other genetic diseases that affect the electrical system of the heart, and these are called the ion channelopathies, and examples include long QT syndrome, catecholaminergic polymorphic ventricular tachycardia, Brugada syndrome, and even progressive cardiac conduction tissue disease. There are some other genetic faults that may affect the aorta, which is the main vessel of the heart, and these are called aortopathies, and the sort of diseases that give rise to those types of aortopathies include things like the Marfan syndrome. So collectively, genetic diseases do affect a significant proportion of our population that exercises, and I would estimate that around 1 in 200 individuals that exercise regularly probably do have a genetic disease that could possibly cause trouble during intensive exercise. The most common inherited cardiac condition is a condition called hypertrophic cardiomyopathy. This is a disorder of heart muscle. It's characterized by abnormal thickening of the heart muscle and usually a relatively stiff pumping chamber. The vast majority of people that have this condition are not able to exercise at a very high level, but this condition is heterogeneous. By that I mean it varies in how thick the heart muscle is and how stiff the heart muscle is. And some people with very mild forms of the disease or very localized forms of thickness can engage in intensive exercise. It is also recognized, certainly in the United States, as the most common cause of exercise-related sudden cardiac death. Other genetic diseases are considerably rarer than hypertrophic cardiomyopathy. There is a condition called arrhythmogenic cardiomyopathy, which may affect the right ventricle or the left ventricle and is due to abnormalities in desmosomal proteins. This is the cardiac glue. So theoretically, clearly, if you exercise intensively and you've got defective glue joining your cells up, then there's a chance that that glue may come apart and cause trouble during repair of the heart, or even at the time that the glue has come apart. This condition is present in about 1 in 1,500 individuals. There's another condition called dilated cardiomyopathy, which, as its name suggests, is characterized by an enlarged main pumping chamber that doesn't work very well. This is present in around 1 in 1,000. And then there are some of the electrical faults I was talking to you about, such as the long QT syndrome or Brugada syndrome, which is present in around 1 in 2,000 individuals. Most inherited heart diseases affect either the electrical tissue of the heart or the heart muscle. So the most pragmatic methods of testing for these is to do an ECG and an echocardiogram. The ECG may show up things like long QT syndrome and Brugada syndrome, and may even show up lots of ventricular extrasystoles arising from different parts of the heart that characterize a condition called catecholaminergic polymorphic ventricular tachycardia. We then have to do an echocardiogram, which is a cardiac ultrasound of the heart, to look at heart muscle structure and function, which is certainly very good at picking up conditions like hypertrophic cardiomyopathy and dilated cardiomyopathy. But there are certain conditions that manifest themselves in a rather subtle fashion, such as arrhythmogenic cardiomyopathy, that may require more detailed imaging, such as a cardiovascular magnetic resonance imaging scan. If we do diagnose people with these conditions, we do require other investigations, either to confirm the disorder or to check for the risks associated with these diseases. And these tests include an exercise stress test or a form of prolonged ECG monitoring. Inherited cardiac diseases are diseases due to your genes, abnormalities in your genes. It's very hard to prevent a mutation that already exists in your gene, because when you're born, you're predisposed to getting that condition. So there is no way of actually preventing it, certainly at this stage. If you've got the gene, there's a chance that you'll get the disease, but there is certainly a way of identifying those diseases and treating them to modify their natural history. So you can actually identify diseases early and treat them and prevent either deterioration in heart muscle function or reduce the risk of sudden cardiac death. It's true to say that genetic diseases may skip a generation. By that I mean that your father may have the disease and he may pass on that fault to yourself, and you may not necessarily express that disease fully, because you can have a gene which may remain switched off or may not express itself properly. So when we test an individual clinically, we may not find any features of the disease, but then you may pass that on to your offspring who may have a full form of the disease. So these diseases can occasionally skip generations. It's not common. Around in about 5% of families we see this, but clearly now that we are in a position where we can readily perform genetic testing more so than we could before, the chances of identifying skip generations are becoming less and less so. But I should also point out that we don't have the full information with genetic testing. For example, we only know 70% of the faults that cause hypertrophic cardiomyopathy, around 50% of the faults that cause arrhythmogenic cardiomyopathy, 70% of the faults that cause long QT syndrome. So there's still a lot of work to be done. And in some cases, of course, you have one bad gene, but you need the addition of something else, another gene that may trigger the bad setup. And that may explain why one member in the family may have very mild disease, where another person in the family may have more severe disease. That's a good question. Theoretically speaking, the gene should be passed down equally. If a mother's got a disease in the nucleus, where the nuclear DNA is abnormal, then there's the same chance as her or the father, if they've got a gene in the nucleus, to pass that disease on. Now, there are very rare conditions where the DNA is not in the nucleus itself, but is in the mitochondria. Very uncommon, but we only inherit our mother's mitochondria. We don't inherit the dad's mitochondria. So if it's a mitochondrial genetic mutation, then that can only be passed on by the mother and not by the father. It's important to emphasize, though, that males, generally speaking, if they inherit the disease, they are usually more prone, certainly with cardiomyopathies, to a more serious form of the disease compared to women.